From County College of Morris, this is CCM All Access.
CCM All Access. CCM All Access. CCM All Access. CCM All Access.
Hello, and welcome to the third season of CCM All Access, the program that brings you news and information from the County College of Morris. Students at CCM, members of the community, people doing good things. I'm Brenda Todd.
And I'm Dan Giordano.
And joining us today is Monica Maraska, Dean of Health Professions and Natural Sciences here at CCM. Welcome.
Glad to be here.
Dean Maraska, can you tell us about the school that you have of Health Professions and Natural Sciences?
Sure. Just to let you know, we call it the School of Happiness, which helps us remember Health Professions and Natural Sciences. And I always say we're the best school on campus. But we have five main departments in our school, one of which is Landscape and Horticultural Technology, which is its own building. It's a LEED certified building, one of the newer buildings on campus. And in that program, we have several degree programs: agribusiness, turf and turf management, as well as landscape design, which is really the biggest program down there. And they also have certificate programs in addition to the degrees, where students sometimes can start with a certificate and complete that certificate, and they become more interested, want to pursue a degree. In addition to that, those courses will transfer into the degree program. And we also have a lot of students down there that just take those classes because they're interested in landscape and horticulture and landscape design.
Right. And that's a beautiful building. That's a new building. When did that go up?
That was probably in the last 10 years, or probably 5 or 6 years. I really can't remember. But it is LEED certified, which means it's very energy efficient, sustainability.
Yes.
It has things like cisterns to collect the rainwater, geothermal heating and cooling. We have a garden on top of the rooftop garden, which helps with energy as well. And it is one of the prettiest buildings.
And you give out certifications.
So we have certificate programs, so certificates in design, garden center, and a couple other certificates as well.
All right, very good. So tell us a little about the healthcare division of your school.
So we have 3 health profession programs: radiography, respiratory therapy, and nursing. And these programs are the only programs on campus that are actually competitive-based admissions. And what that means is CCM is an open enrollment school. However, there are programs that we need to limit enrollment based on a variety of reasons. And these programs, we limit enrollment because there's only a limited number of seats, because these programs all need a lot of clinical experience for the students. So we have limited access to healthcare facilities. We can only put so many students in there. The other thing is the programs require certification and licensing after completion of the degree. And these are very rigorous certifications and licensing credentials, so it's very high academic rigor involved in these programs. And the other thing we look at is what the market can bear. For example, if we produce 1,000 nurses a year, 1,000 nurses aren't going to be employed. So there's a variety of factors that go into that. And we need to look at students who have the academic preparation and ability to succeed in those programs. But we're very proud of those 3 programs because our graduates work very hard as students. When they finish on licensing exams, all 3 of those programs, the students exceed the national average for their licensing exam, and they're really highly employed. The area hospitals and other healthcare facilities really look forward to our graduates because the majority of healthcare workers in those programs are employed in the Morris County area.
Oh, very nice. And you have 2-year programs?
Right, so it's a two-year degree. However, a lot of students will go part-time, so it may take them longer than the 2 years to complete the degree.
Right.
Do you have many male nurses that are?
We do. We have higher than the national average of male nursing. Male nurses do very well. We look at diversity in our professions, not just gender, but ethnic background, those type of things as well. So that last year we had probably one of the highest percentages of males graduate from our nursing program. We had about 22%. Which is really nice. We really like to, we'd like that number to be even higher, but that was a real success for us.
Wow. So how does CCM's nursing program compare to other schools in the area?
Well, I think we are definitely the best program in the area. There are other programs of the 19 community colleges. 17 of the community colleges in New Jersey do offer nursing programs.
That's significant.
It is, because there are over 3 million nurses in the United States. So certainly it's a program that all of those colleges offer, and actually as a whole, all our community colleges in New Jersey do very well. We have our graduates do very well in terms of their pass rate on the boards. They're highly employed. And we tell all our nurses in the nursing program that this is just a step for them. When they get their associate degree, we do expect them to go on to get at least their BSN, if not a higher degree, because that really helps with career mobility and also what the profession demands. We expect that they will get that. Almost all our nurses do go on to do that, and they do very well. They articulate with a lot of the local four-year programs in the area, and they always say our students are some of the best students that they have.
And there's specialties, correct? There's specialties that they
right.
can
So
go
after one gets their registered nurse licensure, they can go on when they are in school to specialize, and that's usually at a master's degree level in terms of education specialty. And then they can also specialize within the discipline or the profession itself and get certifications that the professional organization will offer.
Right.
And so are there any new initiatives within these three schools that you're excited about coming forward?
Well, one of the biggest things we're very excited about for our healthcare professions is that we're anticipating starting, we're going to have a healthcare simulation center, the Paragano Family Foundation Healthcare Simulation Center, and that will be a virtual hospital in new space. The engineering department will be moving out to their new building, which I think groundbreaking is tomorrow, if I'm not mistaken. After they move out, that will give us, I think, about 5,000 extra square feet to actually put in a healthcare simulation center. And we're very excited about that because that's going to include not only nursing, but radiography and respiratory therapy as well.
Right.
We will do interdisciplinary collaboration. And really, when you walk into a simulation center, you're basically walking into what actually seems like a hospital.
Right.
So we have a lot of the equipment. We have high fidelity simulators, which actually they talk, they breathe, they react to any medication, and we're able to utilize them in simulation. So that's what we're really excited about.
Remarkable.
Yes,
That's a game changer, really.
It really is. It provides, we already do simulation on a smaller scale,
Right.
but simulation, just like flight simulation, it allows students to have the real experience. It allows them to go through the whole process, which means sometimes they fail. When they're in the hospital and we're doing clinical, if a student is going to do something that's not right, we're going to stop them right away. That's what we do as instructors. That's our, you know. But in simulation, we actually let the whole scenario play out so that sometimes patients die. And, but more often than not, we have successes, but it allows the student to get a real life experience. And sometimes to experience those things that they may not experience as a student. For example, if there's a code in the hospital or somebody needs to be resuscitated, students are not to be in that situation. They're observers, whereas we can actually create that situation, and they're the ones that are actually providing the care and doing the techniques and skills and stuff.
So what are some of the things that make a good nurse? It's the students that are coming into the program, the things that you see right away that, that you say, this person's going to be a really good nurse?
You often don't know.
Yeah.
You often don't know right from the beginning. But what we do know in terms of whether it's nursing or the other health professions, and really in all the other disciplines, is somebody that's committed, not just in terms of being very interested or passionate. I always say, you really can't be passionate about something you haven't done yet. You might think you're passionate
Sure.
or really
Right.
think that this is
Sure.
something that you're going to enjoy and are drawn to. But the commitment in terms excuse me, the commitment in terms of the academic rigor and the studies that go along with it. So it has to be the time and place. It has to be that you're able to commit to studies, attending class, being very interested, and also being involved in the discipline itself. Maybe volunteering, maybe working in that area also helps. Sometimes students might be a little timid at first. I've had students who start in nursing 1, our first, and they're very different by the time they graduate, and they're very different by the time they're out there in the field. When I was still practicing, it was not unusual that maybe one of the students that I had taught in one of the foundation courses, I'd be working a weekend at the hospital, they'd graduate, and I'd be working side by side next to a student that I taught.
Oh,
And it taught me a lot, because very often to see them grow and learn what you might see in nursing 1 versus when you see them out there working, flourishing, it's very different, and it's very satisfying.
And you've been a professor of nursing at the school for a good while as well, right?
Yes, I started, actually I was working at Morristown Medical Center, and the students were on the floor with one of the instructors who has since retired, and I enjoyed working with the students, and she approached me and she said, "Oh, you should try adjuncting at County College of Morris." And to tell you the truth, I had never thought about teaching in nursing. That was never, at that point I had been a nurse for over 20 years, and it had never really entered my mind, but I realized I enjoyed working with the students. So I applied, and there was an adjunct position that was available, and I really liked it, and when a full-time position opened, I applied, and it's been history. I fell in love with teaching. And I tell my students that, never close the door, never say you don't want to do something. Always explore it and take the opportunity. Very often a nurse or somebody else will say, "This is what I want to be," and they don't really allow themselves to explore or consider other options.
Yes.
So I always stress that in the beginning, explore everything, especially while you're a student.
Yeah.
Because that really is the time to do those things.
Absolutely. Well, now we're going to take a quick break. Stay tuned, and we'll be right back.
Not all County College of Morris students look like me.
Some look like me.
Or me.
Or me.
Or me.
We all come to CCM at different stages of life.
And for different reasons.
I plan to transfer to a university.
I'm training for a new career as a nurse.
But we all know one thing.
CCM is where we want to be.
So check out the website.
Check out the website.
Check out the website.
And let CCM connect learning and your life.
And we're back on CCM All Access, and we're here with Dean Monica Maraska. So, what can you tell us about the rest of the programs within the school?
Well, one of the great programs that we have a health exercise science, and that department actually is housed in the Health and Physical Education building. So under health exercise science, which is headed by our chairperson, Dr. Michael Paul, we have exercise science degree, which is a transfer degree. Many of the students who are studying exercise science will transfer on to four-year schools to study perhaps exercise physiology, sometimes physical therapy, exercise, and other exercise science careers. We also have a personal trainer certificate in that department as well. So we have a lot of students who will come in who are interested in personal training and get that certificate, and it's also a resume builder. So students who are pursuing a degree in exercise science may also have their personal training certificate, and it kind of adds to their skills upon graduation. Also allows a lot of students to do some side work doing personal training on the side while they're pursuing their degree.
How long, excuse me, but how long does it take to get the personal trainer degree?
So
if they're
the
thinking of doing
personal trainer certificate you could actually get in 2 semesters.
that? Okay.
And, but also under the department, we have our public health degree, which is one of our newer degrees that's been growing very nicely. So that is, you know, we have those health professions, but then there's that whole aspect of taking care of health populations
Yes.
and communities of health.
Right.
And the
And some of
need
the careers.
yeah, so some of the careers for that, very often, again, that's a transfer degree. So our students will go on to get a bachelor's degree, maybe a master's degree as well, working in public health. But along the way, there's a variety of entry positions in public health that one can do.
Right.
So that program, as I said, we've had for about 4 years now, is doing nicely, big interest in that. Especially as we look at communities and keeping people in the communities and keeping communities healthy. Even things just as the aging population, when we're looking at keeping them home, or health of the community in terms of the environment, and those type of things.
Sure.
The CCM's students often come back to the same area with their professional careers?
It's not unusual for people to stay in this area.
Right.
So we'll find if you go into any of the health hospitals or whatever locally, I guarantee you will come into contact with a CCM graduate. And that's not only in our specific disciplines, but for example, in our biology department, we have many students who are studying biology. Maybe they want to go on to be physicians, dentists, veterinarians, nutritionists. Maybe they want to teach biology, be a researcher. So you come into contact with them. So you may be at the vets and they say, I started right at CCM. A dentist, something like that.
Right.
So,
And a lot of students, nursing students, go on to become physician's assistants, right?
no, generally physician's assistant is separate.
Is a separate altogether.
So very often if you're interested in being a physician's assistant, you will actually major in biology.
Okay.
So that physician's assistant and nurse practitioner are very similar. There are similarities in the profession, but they're different in the sense of a physician's assistant will practice specifically under a physician.
Okay.
Usually working with just one or a group of physicians, whereas nursing, the scope of practice is a little broader, but there are commonalities. So a physician's assistant will start generally in biology, major in biology, and go on to physician assistant school. So you're talking about probably about 6 years of education.
Okay.
Yes.
Okay.
Yes.
Can you tell us more about the biology department?
Sure. So in biology, we have actually biology and chemistry. It's under the same department. The majority of students are pursuing a degree in biology, but we have chemistry majors as well, along with chemical technology and chemical technology environmental option. And that's an applied science degree, so that somebody who's interested in going right into the workforce, maybe working in pharmaceuticals or environmental sustainability, may get that degree. Whereas if you're looking, again, to go into nutrition, maybe physical therapy, research, biotechnology, you would get a degree in biology and then transfer to a 4-year school to finish your studies, or get at least a bachelor's, depending on what you want to do, or go on up to the PhD level.
So first,
as a matter of, what I would like to mention, probably one of the prime examples of that is Dr. Maria Izaza, who was our department chair in biology and chemistry. She actually started here as a student at CCM. She worked in our biology lab. She went on, she got her PhD in microbiology, and she has returned and is chairperson and microbiologist.
That's so cool. So along that, a lot of students who are interested in coming into a science, so biology or chemistry, they are thinking 4-year schools, big schools. So what can you tell us about what CCM has to offer to these students? Because it's a little bit different from the mindset that the public often has, but I'm seeing there's a lot of value that taking this kind of path can have. So what can you tell us about that?
Absolutely. I always say CCM is a great place to start. It is highly respected school. Our degrees transfer very easily to 4-year schools. Our courses are very rigorous. They recognize that. Our students do extremely well upon transfer, and we hear that again and again. We have many articulation agreements with 4-year schools, both private and public, in-state and out-of-state. They value our students, and they know, especially students when they complete their degree here, chances of them going on at a 4-year school and completing are very high, and actually statistically I think just as high if not higher than students starting there, because they've proven their ability for the academic rigor, ability to complete, and that they know when those students transfer they will be completers there as well.
Right.
So for years we've heard about the shortage of nurses. Is that still the case today, or?
So the shortage of nurses, it is something that is kind of like the stock market. It goes up and down. I've been a nurse for over 40 years, and I've seen it up and down. Right now, there is a shortage in the immediate area. Not as drastic as they predicted, and there's several reasons for that. And one of that is that nurses did not retire at the rate that they thought they would. As nurses, the majority of us are older rather than younger, and many of us have chosen to remain in nursing or work a little longer than we thought we were going to, so that there was not a mass exodus, but we see this constant, it's more of a slower slope of nurses leaving and retiring, so that there's always that ongoing need of
What about the
nurses
nurses coming in? How has that changed over the years?
So people coming into nursing, as they enter, there's a variety of things that have changed over the last 20 years and even 10 years. Is that, for one thing, students start with their AAS degree, know that they have to go on and get their BSN. There was a time where that was, maybe considered by some as being optional, and it really isn't anymore. They need to do that for the profession and for career mobility and for what really nursing is, what we're expected to do now. I always tell students, it would be very hard for me to go back to be a nurse and know everything I need to know that the students need to know.
Sure.
I have had 40 years to learn that and see all the advances, but if I had to go to school back then and learn what the students do now, it would be much more difficult than it was at the time. And I was a good student.
So going off of that, if you were to go back or to give advice to future students coming forward, what would you tell them? Because you've had a very large amount of experience in the field. So what would you offer to them?
Well, to nursing students, I would say always keep your options open. There are many, many things that you can do in nursing. And I think we find this in a lot of other careers as well. So you might start out to do one thing in your career and end up doing something that's very different. Within nursing itself, I've been a bedside nurse, I've been a clinical specialist, I've been an educator, I've been an administrator, all as being a nurse. We have nurses who have actually gone outside of the field of nursing and done things very different than nursing, but their nursing background has helped them start their own business, things like that. And we find that in the other careers as well.
Tell us a little bit about how you got started with nursing and kind of what your path has been.
Well, when I graduated nursing school, I wasn't even 21, so I always say I was able to save lives, but I wasn't able to drink. But I say that as a joke. But it was very different back then. Nursing has really grown as a profession. What nurses have been able to do, what we're expected to do within our profession. I really did see it go from being the handmaiden of the physician to being very independent with a large scope of practice and being really responsible for the care of patients and the direction of that care. Tremendous opportunities in nursing that didn't exist before. And the advances that we've made in healthcare in general has impacted nursing. The expectations of what we're expected to know is incredibly more advanced. Not just the technology, but because of what we have as nurses in our profession have grown. So it's very exciting, very different. And I anticipate that those changes are going to continue well into the future. It's going to be very different, probably 5 years from now. The change at the pace of which it changes is very different. But at the end of the day, nursing is one of those careers that we will always have patients, and we will always have to be ready to receive our patients and care for them. This is something that, despite all the technology, the ultimate outcome and the ultimate goal is to take care of those patients, and that has never changed.
Absolutely. And teaching, so you've parlayed that into teaching. Do you still do nursing in any capacity?
Well, no, I really don't, in terms of, I'm not actively practicing my clinical skills.
Right.
But I do oversee the nursing department, and I probably interfere with them more than the others, just because that's my area of expertise. But I'm a nurse who happens to teach, a nurse who happens to be administrator. My license is current. So I am administratively still doing nursing.
And for you, throughout your career, this is kind of just a fun question. What's one of the most rewarding experiences you've had? Or maybe something that was a little bit different that kind of took you off guard?
Wow, that's a really interesting question. I guess what I would say is doing things that I never anticipated. When I first became a nurse, I never thought about wanting to be a teacher. I never thought about working at a community college. And I absolutely am so thankful for the opportunity and so glad to be here, because it's really been the best 20 years of my career.
Oh, that's fantastic. Well, Dean Maraska, thank you so much for joining us. It's
Thank
been
you.
a pleasure having
It's been
you
a pleasure
here.
for me as well.
This has been another edition of CCM All Access. Thanks for tuning in, and we'll see you next week.